Hello and welcome. Today, we're diving into a serious, but thankfully relatively uncommon, condition: bladder perforation. We'll explore what it is, what causes it, how it's diagnosed, treated, and more. Whether you're a medical professional, a student, or simply interested in learning more about the human body, this video will provide a comprehensive overview of bladder perforation. So, what causes a bladder to rupture? The etiology of bladder perforation is varied, but it generally boils down to trauma or pre-existing bladder weakness. Traumatic causes include blunt abdominal trauma, such as from car accidents or falls, or penetrating injuries like stab wounds or gunshot wounds. Iatrogenic causes, meaning caused by medical intervention, are also significant. These include complications from cystoscopy, transurethral resection of the prostate to ARPA, or other urological surgeries. Finally, less commonly, bladder perforation can occur spontaneously, particularly in individuals with pre-existing bladder conditions like bladder cancer, diverticula, or chronic urinary retention, causing overdistension of the bladder wall. Now let's talk about the pathophysiology, or what actually happens when the bladder ruptures. A perforation creates a breach in the bladder wall, allowing urine to leak into the surrounding abdominal cavity. This leakage of urine triggers an inflammatory response as the normally sterile urine irritates the peritoneum, the lining of the abdominal cavity. The resulting inflammation leads to peritonitis, a serious and potentially life-threatening condition. Furthermore, the loss of urine from the bladder can lead to dehydration and electrolyte imbalances. The location and size of the perforation, as well as the promptness of diagnosis and treatment, are all crucial factors in determining the severity of the consequences. While bladder perforation isn't a common condition, understanding its epidemiology, or how often it occurs and who it affects, is still important. Traumatic bladder ruptures are more frequently seen in younger individuals, particularly those involved in high-impact activities or accidents. Iatrogenic perforations are more common in older individuals undergoing urological procedures. The incidence of spontaneous rupture is relatively low and is often associated with pre-existing bladder abnormalities or chronic urinary retention. It's important to note that timely diagnosis and management are crucial for all age groups. Recognizing the signs and symptoms of bladder perforation is essential for prompt medical attention. Common symptoms include abdominal pain, which can range from mild to severe and may be diffuse or localized. Patients may also experience difficulty urinating, blood in the urines, hematuria, and swelling in the lower abdomen. In cases of traumatic perforation, there may be obvious signs of external trauma. Systemic symptoms, such as fever, nausea, and vomiting, can also develop, particularly if peritonitis has set in. If you experience any of these symptoms, especially after trauma or a urological procedure, it's crucial to seek immediate medical evaluation. Diagnosing bladder perforation requires a combination of clinical assessment and diagnostic imaging. A thorough medical history and physical examination are the first steps. Imaging studies, such as a cystogram, where contrast dye is instilled into the bladder via catheter, are crucial to visualize the perforation and identify the site and extent of urine leakage. A CT scan of the abdomen and pelvis can also be helpful in identifying other associated injuries, especially in cases of trauma. Blood tests may be performed to assess for signs of infection or electrolyte imbalances. Bladder perforations can be categorized into different types based on their location, cause, and extent. Intraperitoneal ruptures occur when the perforation is in the dome of the bladder, allowing urine to leak directly into the abdominal cavity. Extraperitoneal ruptures occur when the perforation is outside the peritoneal cavity, often in the bladder neck or lateral walls. These ruptures can lead to urine accumulating in the pelvic tissues. As mentioned previously, perforations can also be classified as traumatic, iatrogenic, or spontaneous. Understanding the type of perforation is important for determining the appropriate treatment strategy. Treatment and management of bladder perforation depend on the size, location, and cause of the rupture, as well as the patient's overall condition. Small, extraperitoneal ruptures may be managed conservatively with catheter drainage to allow the bladder to heal on its own. However, larger ruptures, intraperitoneal ruptures, and cases with significant associated injuries typically require surgical repair. Surgical options include open repair or laparoscopic repair. Antibiotics are usually administered to prevent infection. Post-operative care involves continued catheter drainage and close monitoring for complications. While not all causes of bladder perforation can be prevented, there are measures that can reduce the risk. Safe driving practices and injury prevention strategies can help minimize the risk of traumatic bladder ruptures. Careful surgical technique and adherence to established guidelines during urological procedures can help prevent iatrogenic perforations. For individuals with pre-existing bladder conditions, Regular monitoring and appropriate management can help reduce the risk of spontaneous rupture. Ultimately, a proactive approach to safety and healthcare is crucial. The prognosis for bladder perforation depends on the promptness of diagnosis and treatment, the size and location of the perforation, and the presence of associated injuries or complications. With timely and appropriate management, most patients can expect a full recovery. However, delayed diagnosis or inadequate treatment can lead to serious complications such as peritonitis, sepsis, and even death. Recent research focuses on improving surgical techniques for bladder repair, developing less invasive diagnostic methods, and exploring new strategies for preventing iatrogenic perforations. Continuing advancements in medical knowledge and technology are constantly improving the outlook for patients with bladder perforation.